Hello again and welcome to my blog. And today I will get on another conference call with my dentist with questions on how to fix the cavities that he saw during my dental exam. So here goes. Greetings to my favorite patient. This is Dr. Sal again. Glad to help you with your questions regarding your dental care. So I read your email regarding the restorations that needs to be done to get your teeth back in tip-top shape. So fillings are placed after preparing the tooth to fill a cavity, and the common materials used are amalgam or composite resin. On this call, we can talk about their difference to help you make an informed decision for your care. So amalgam fillings, or commonly called silver fillings, is a type of filling material composed of alloy and mercury. So with what I said, I know what's on your mind right now. Mercury, right? Not to worry, as the ADA or American Dental Association considered amalgam restorations safe with the data existing on its safety and reliability with the general population and it's used over about 150 years now. Composite resin or white fillings on the other hand is made of silica and resin and considered the newer approach of dentists as it is constantly improved and with different types. The different types are meant for different situations where the filling is needed, and it could be on its location or purpose, like preventive resin restorations or preventive sealants that are more conservative than regular tooth preparation. Comparing both with aesthetics and look, composite fillings show or imitate natural tooth color that is great in using with anterior teeth, while amalgam silver fillings may show some metal-like aesthetics. Strength of the materials majorly depends on different factors, but I would say that the success of the restoration and durability is dependent on the technique used and how much healthy tooth structure is left to work with. Some studies say that amalgam can withstand greater forces, but composite materials are evolving quickly to be closely compared with strength. Speaking of tooth structure, amalgam may require removing more tooth structure for mechanical retention, as composite resins may require less tooth preparation and utilize bonding agents to adhere on tooth surface by chemical and mechanical retention. I know you're wondering the cost difference of the procedures, as it is also one of the most common questions I get from my patients. Amalgam is less expensive than composite procedures, so if you are in a tight budget, this could be a good option as well. When these fillings are placed, some can expand or shrink, and when placing composite fillings, it has a little shrinkage when polymerized or cured. Since amalgam is metal, it has greater temperature conductivity that could cause tooth sensitivity sometimes, so that's one of the risks of using amalgam restorations. Lastly, when placing the fillings on a tooth, composite fillings is more technique sensitive as it requires a dry field with no contamination while following the manufacturer's instruction of rinsing and drying on appropriate times. So, those are the major differences of resin composite fillings and amalgam alloy fillings. I hope I answered your questions, and as a provider, we are confident on the techniques that we use to provide you the best care considering your preferences. Have a wonderful day.